OCD stands for Obsessive Compulsive Disorder. So the O, the obsessions, these are the intrusive thoughts that feel like they come into our head in an uncontrollable way and are often feel quite negative. The C, which is the compulsion, this is what we do in relation to the obsessive thoughts, and it's often a way of trying to reduce the anxiety that these thoughts create for us. Common obsessions in children and teenagers are things like fear about harm coming to themselves or other people, feeling the need to confess lots of things, or fears about their religion, worries about contamination or spreading germs or bodily secretions. Those are some very common obsessions in children and teenagers. The compulsions are what you might notice as a parent your child doing. Common compulsions are excessive hand washing, having to do things in exactly the right order, walking in and out of doors multiple times, or having to tap a door before walking into a room, constantly checking switches, or seeking excessive amounts of reassurance from you as a parent. There's some red flags that you might notice as a parent that mean you need to seek more urgent support. So these might be if your child is talking about self-harm or expressing suicidal thoughts, if the compulsions your child is showing are taking an excessive amount of time, so longer than 1 hour per day, you might need to seek help more urgently. And you can do this through getting an emergency appointment with your GP or calling 111. But in a real emergency, if you're really worried about your child's safety or the safety of somebody else, you need to dial 999 or take your child to the nearest emergency department, where they'll have trained mental health professionals on hand to help you. Our first tip is to understand OCD and how it relates to other disorders such as anxiety. OCD is considered an anxiety difficulty. So when your child is having the intrusive thoughts that are coming to their mind, it will cause a level of anxiety in them that's associated with all the usual things we expect with anxiety, the feeling stressed, the heart rate going, the feeling sweaty. The difference is that the compulsion, which is there to try and stop the worst thing from happening or to try and to reduce the anxiety, becomes quite ritualised, and it offers temporary relief to your child. So understanding the link between the thoughts and the compulsions means that we can find ways to help support our children rather than just telling them to stop the behaviour, which we know doesn't work. The second tip is to understand and help your child understand their specific OCD cycle. Every child's intrusive thoughts are different, every child's compulsive behaviour is different, and it's really important as a parent to try and understand what is going on for your specific child in terms of their thoughts and their behaviours. If you can try and create a space that's containing and validating their anxiety and feels non-judgmental for them, you might be able to encourage them to write down the situations that the intrusive thoughts are more likely to come about in. If they don't feel able to write it down themselves, they can talk with you about it, and then maybe you can keep a bit of a diary of these situations. The third tip is called exposure, and it's something you might do alongside your child's therapist. Your child's intrusive thoughts will be telling them that something bad is going to happen, and therefore they need to do something to stop that bad thing from happening. Exposure is exposing your child to this bad thing. So for example, if they're worried about germs, it might be exposing them to potential germs, but then them not doing their compulsive behaviour, testing out to see if this bad thing really does actually happen. In the short term, this will actually increase your child's anxiety, but if they sit with the anxiety for long enough, it will actually prove to them that one, they can manage difficult anxiety, and two, that the bad thing that they think is going to happen doesn't actually happen. Exposure is something that needs to be managed carefully, so it's important that you do this alongside your therapist. Our fourth tip will discuss some relaxation methods that your child can use to manage the anxiety that comes about in relation to OCD. And if you can teach your child some relaxation methods to reduce the anxiety, it can help break the cycle of the intrusive thoughts. One method of relaxation is called progressive muscular relaxation. So this is where you encourage your child to systematically go through their body, tensing each different muscle for up to 5 seconds as hard as they can, and then releasing it. And if your child can do this all over the body is actually really shown to reduce the tension that comes along with anxiety. We would really encourage to educate yourself as much as possible about OCD. Even by watching this video, you've taken a real step towards supporting your child learning to manage their OCD. Looking after a child with OCD can be emotionally and physically draining, so it's really important that you look after yourself as a parent. There's lots of support groups out there with other parents that you might be able to access, or accessing your own support if you need to.